Hi, everyone. This is Frances Badilla. Welcome back to another one of our conversations online about healthcare in this time of COVID. And I am glad to welcome you to Healthcare Matters in this election. Learn why. Clearly, this coming election is pivotal in our country, and healthcare will factor in very greatly. And so today we have a couple of people with us who are going to talk about the problems, the solutions, and the kinds of actions that are needed with me. And they are going to talk from the federal perspective as well as the state perspective. So let me start by introducing Stan Dorn. Stan is a longtime friend of Connecticut. He's a health policy expert currently at Families USA, and previous to that at the Urban Institute. And it was at that time that he worked very closely with us in Connecticut to design ways in which we could actually get closer and closer and achieve universal health care. So welcome back, Stan. Great to see you.
My pleasure to be with you again, Frances.
And I have with us here today as well, Angie Idrovo. Angie is the co-director of Connecticut Students for a Dream. C4D is how we lovingly refer to it. C4D is a statewide organization of dreamers and allies that looks to empower undocumented students and their families through advocacy and raising awareness about the issues affecting undocumented families. We're going to really start today by kicking off what the foundation views as our I Am a Healthcare Voter campaign. Kicking off this campaign is really in the context of the dire needs that Connecticut has. There was a recent survey that we released last week where people are very worried about being able to afford healthcare. And that cuts across people who have health insurance through their employers, people who get their health insurance through Medicaid, and people who have to buy it on their own. And folks are worried about affordability now, and they're worried about affordability into the future. They're wanting government to do something about the price and cost of healthcare. And with the pandemic, which we all know has had disproportionate impact on people of color and lower income people, working people, essential employers, the cost issue has become even more serious and critical. Losing a job now means losing your insurance. We actually estimate that in Connecticut, we have had a 30% increase in the uninsured rate in the months since the pandemic. So today we're going to talk about problems at the federal and state level with a focus on access to affordable coverage and care, and the problematic handling response to COVID-19. We're going to hear from Angie in her role as an advocate for the undocumented, and we're also going to hear from Stan in his role as an advocate for federal policy. We're going to talk about concrete solutions and about taking action. Because there's so much at stake in this election and for healthcare, and we wanted to do it justice in this conversation and are going to go a full hour. We'll also be taking your questions, and we're really interested in your questions. So we'll have two ways that you can pose questions. One is, both are through Zoom. If you go to the participants icon at the bottom of your screen, on the right-hand side, there is a button that says raise hand. You can raise your hand and be recognized to give your question. You can also write your question in the chat box, which is how we've been doing it in the past. But we're going to go into conversation for about 25 minutes or so, and then we'll open it for questions. Okay, so I'd like to start with you, Stan. Welcome back, as I said earlier. And I'd like to, ask you, put a face on these issues. What are the major coverage and affordability issues and COVID issues?
Well, there are two big issues. One is that lots of people don't have any insurance at all, particularly since the COVID-19 pandemic hit and the economy has gone south. Tens of millions of families are now without jobs that somebody in their family had before. And in many cases, that means no health insurance. And the consequences are just devastating. It means if you are sitting at home and you get symptoms consistent with COVID, a cough, a fever, we know you are much more likely to delay going to get care because you're worried that you're going to get a bill that you just can't afford. And that means you delay seeking services. That puts your health at risk. It endangers your family, your friends, your neighbors, your coworkers, your customers.
Right.
That's a bad situation. But, cancer and heart disease don't go on vacation when COVID-19 comes to town. And doctors tell us that we are seeing really shocking drops in people's receipt of preventive care. Part of that is people are worried about going to the healthcare system and getting the disease. Part of it is that more people don't have healthcare and they're worried about coverage. We know that if you don't have insurance, you are literally 4 times as likely to delay getting the care you need or not to get it at all. And that means that women who don't know that they're developing breast cancer get that condition detected later when it's harder to treat successfully. It means
Mhm.
people who know they have heart disease can't afford to fill their prescriptions or cut pills in half. And the consequences are grim. It's also a question of financial security. The Census Bureau tells us that half of US households have lost employment earnings since mid-March. Some of us have become unemployed, others have fewer hours at work or lower pay. We know that tens of millions of people don't have enough food to eat. Many of them are in families with children. Tens of millions of people are late in paying rent or mortgages and are worried about making the next month's payment. People are
Mhm.
dipping into savings. People are putting items on, hawking items. It's a lot of financial insecurity during this period of the worst economic downturn since the 1930s, and to pile unpaid medical bills on top of that is just unconscionable. So problem number one is people who have no insurance at all, which subjects them to healthcare risks and financial risks.
Which we
Problem number
still, mhm. Which we
problem number
still have lots of and growing.
exactly. And problem number two is people who have insurance but are underinsured, who have deductibles that are so high they just can't afford to go get care, or co-insurance or co-payments, or surprise medical bills. The Commonwealth Fund just came out with a study finding that over the past decade, the percentage of people who have a job that provides health insurance but are underinsured, who have to pay more than 10% of their income for health care, it's gone up by 50%. People may have an insurance card, but
Mhm.
increasingly employers are dumping more and more of those costs onto workers and their families. And there was a survey done by Kaiser which found that literally 1 in 4 people with chronic illness who has a employer-based plan uses all their family savings to pay for healthcare during the year.
Mhm.
And it's a mess. I mean, we made a major step forward back in 2010 when we passed health reform, and millions of people got coverage, and people got preventive services covered without copays, and people up to age 26 could go in their parents' plan, and Medicare coverage improved in some ways. But the job is only partly done, and unfortunately, we've seen backsliding since 2016. The
Yeah.
Census Bureau just came out with findings yesterday that just tell this amazing tale that from 2010 to 2016, everybody gained. People in every racial and ethnic group, children, adults, coverage got better year after year after year. Since 2016, everybody has lost. Regardless of your racial and ethnic group, parents, children, everybody has lost coverage year after year after year. So, the stakes in this coming election could not be higher when it comes to healthcare.
So this is a really dire situation that you're putting before us. What does the new Congress in 2021 need to do to address these problems?
Well, I'm actually optimistic that, if we get the right kind of leadership in Washington, there could be tremendous progress made.
Mhm.
There's a lot of agreement across the board, consumer advocates, civil rights organizations, industry, that the rising tide of healthcare pain needs a quick answer. And that means we need
Mhm.
to do something about the states that don't provide Medicaid to their poorest uninsured. It means
Uh-huh.
that people who have incomes too high for Medicaid but can't afford insurance and need more financial help buying it on the exchange.
Mhm.
It means we need to dramatically ramp up the kind of help people get navigating through our insanely complicated healthcare system and getting to coverage. And it
Mhm.
means we have to finally address the really horrifying inequity that millions of people are who are undocumented are paying taxes and contributing to our economy. We rely on these folks, and yet, and if they get really, really sick and go to the hospital emergency room, we'll make sure the hospital gets paid. But what about when people need care on an ongoing basis? It's outrageous that folks who are
Mhm.
contributing, they can't even use their own money to buy health insurance if their immigration status doesn't, fit the congressional specifications. So we got to deal with that problem in the next couple of years. And with the right federal leadership, I think we can make a lot of progress.
So do you think that the Congress, what do you think Congress ought to be doing? What are the solutions to the affordability problem?
Well, number one, we need a substantial increase in premium tax credits the federal government provides to people with incomes too high for Medicaid, but too low to afford insurance. And the House passed legislation that would do this, that would borrow a page from Massachusetts, which has achieved 97% coverage, in large part by making health insurance a lot more affordable to low-wage workers and their families. So that's number one. Number two is fixing this huge hole in our system for undocumented immigrants and saying, if you're in the U.S. and you're contributing, you get, we're not going to wait until you get into the hospital emergency room and it's most expensive to take care of you to contribute. We're going to say you're helping our society. We're going to step forward and make sure your needs for healthcare are met. So those are
Mhm.
two of the most important things. And I think there is going to be debate about the basic structure of American healthcare.
So
Medicare for all, public option, state experimentation, but
let's hold on that. Let's
yeah,
hold on that, Stan. Let's come back to that
right,
in a few minutes. Let's talk about the undocumented,
sure.
Angie. And the states are on their own, right? Because the federal government has basically disabused the undocumented population. So Angie, the undocumented healthcare in Connecticut. Tell us more.
Yeah, also thank you, Frances, and the Universal Healthcare Foundation for the invitation. It's also my pleasure to be here with all of you. There is an estimate of 130,000 undocumented people in the state of Connecticut. None of these people have access to public health insurance. This means that there is 130 residents of Connecticut who are not taking care of their health because they do not have healthcare insurance. And the many challenges that the undocumented community faces, it's around job security and permanent jobs, wage theft, detention and deportation, lack of access to higher education, lack of access to healthcare and mental health care, resources and coverage, and also lack of access to healthy environmental housing conditions. And I just want to uplift all of that because being a healthy person, it means that you can live in a healthy environment and that you have a job where that you don't have to be thinking every 6 months how you're going to provide for your family.
Mhm.
But when we talk about access to healthcare, Connecticut residents, Connecticut undocumented residents contribute annually 145 million on state and local taxes and 252 million in federal taxes. And even though we contribute to into the economy of the country and paying taxes that usually some of the money gets subsidized into Medicaid, Medicare, and other health programs at the state and federal level. we don't get to access any of those programs. So unfortunately for the undocumented community, is either thinking about holding their pain because the emergency room or any other specialty health care center that will cost a lot of money would not be able to, they will not be able to provide with the amount of money that it will be required for them to pay those care, to pay their care. So then that's their bills, yeah. So there's three main ways to access healthcare from the undocumented community in the state of Connecticut. And the first one is being in partnership with, or being in partnership with different centers like Jericho Partnership and Americares. But those centers usually most likely attend only young people until the age of 21st. So that means that when an undocumented person is not a child anymore, then they have to really find their own ways to provide healthcare access for themselves. And the majority of the centers that usually give free access, like Jericho Partnership and Americares, don't usually have a lot of different things that they can do with the patients, meaning that they only provide basic needs. Yeah.
So these are really programs. I'm sorry to interrupt you, but just to clarify, the Jericho program through AmeriCares is really a program that is set up that is not real systems change. It's a program that allows people to get some care, as you say, not all the care that they need, and it is insufficient, is the point, correct?
It is. It is, and most of the time when our undocumented community do not know about this places, they tend to not get the care that they need, right? And that really delays what they could have been prevented into something more dangerous, into something that later on in their lives they will have to go for full treatments. So it's very scary. The other main thing is the documented population is always a risk of, and before COVID happened, it was always a risk of detention and deportation, and that puts a lot of mental health instability in the undocumented population, right? Thinking about if I get to go back home and be with my family, or if I really get to stay in this country and continue having a life here, really impacts how the undocumented population continues to live their lives daily. And I know all different stories, all the stories from the documented community is differently, but I would like to share a personal story from my family, focusing on my dad. My dad is now 52 years old. He recently turned 52 years old, and we've been in this country for more than a decade. So all this time he has been uninsured, most likely doing home remedies, most likely just going with over-the-counter medicine. But it was until a year and a half ago that he got this amazing job at construction, and that company offered him insurance, private insurance. So he accepted, and after a decade, when he was 51 years old, he was finally able to access healthcare, right? He was finally able to have a primary care doctor. He is the first person in our family to be able to have to schedule different doctor meetings around, right, muscular pain, around diabetes, colon cancer, and all of these things that he should have been checking up earlier on his 40s, and is now doing it, right? And the situation of my dad is a rare situation, a very lucky situation. And with that being said, even though he now has insurance and he's able to access to healthcare, obviously he usually does co-pays for any any appointments, any doctor's appointments, but we don't know how long he will be able to stay at his job.
Mm-hmm. Mm-hmm. So what are the solutions that C4D is promoting? What is the policy solution that C4D has a campaign on? Tell us about it. I think we're having a
We don't know how long does the company C4D. Can you hear me?
I can hear you now. Yes.
Can you hear me now?
For a minute there, it was.
Oh, okay, perfect. Yeah, the Wi-Fi is always tricky. So C4D is working to push the legislators in Connecticut and the whole legislature to open Husky, the Medicaid program in the state of Connecticut, to all Connecticut residents, regardless their immigration status. That would really support the undocumented community on having public health insurance and being able to access the different care that they need.
I think Angie is having some connection issues. So maybe what we can do is talk a little bit about the kind of actions that are needed. And when she comes back, she can say more about the Husky expansion campaign. But, you know, back to the federal, right? We need a change in federal policy priorities that's really only achievable through a change of administration and a Congress that can function.
Yeah.
And the way to make that happen is to vote. The way that, you know, our vote matters now more than it ever has. And it's so important to get educated, to register to vote, obviously, to plan for voting. Very, very critical with absentee voting and all the confusion that has been created about the Postal Service and all of that. Everyone needs a plan for voting. And so one of the ways that we think we really need to make healthcare matter in this election is by having a plan, voting, and then keeping your attention on politicians and holding them accountable. So I went to an action call to action, Angie, because I wanted to give you a chance to come back. Do you want to finish talking about the Husky expansion campaign?
Yeah, thank you, Frances. Apologies for that internet issues. Yeah, so we are looking forward to be able to work on a bill this upcoming legislative session, but we don't know if that's going to be possible with all the changes that has happened at the Connecticut Capitol. But it will essentially, our campaign is pushing for Husky, the Medicaid program, to be open to all undocumented people in Connecticut, regardless, right, of their immigration status. And we hope that the community out there understands how important is accessing to healthcare for everyone, not only for undocumented people, but also for everyone else, and how through this pandemic, we have seen that this issue about healthcare really should be on top of our list to make sure that the people who we are electing in this upcoming election are people who are willing to really talk with a community and really work for those issues. It is very scary to know that 130,000 people in Connecticut who are undocumented do not have access to healthcare within a pandemic. So that's a public health crisis in Connecticut. So we need to take care of that.
It certainly is. And, you know, undocumented people can't vote, right? So the issue is making sure that other people who can vote understand these issues and understand what's at stake and become educated and create a plan. And immigrants are part of a varied network of family and friends. Some people can vote and some people can't. all those people who can vote ought to be voting, and they ought to be healthcare voters. So your campaign is really to bring more awareness, correct? And more allies in with you to be able to educate policymakers on the situation of undocumented families. I'm going to talk a little bit about the state, right? Because there's always the tension between what we need to have happen at the federal level, as we started talking about Stan, and what needs to happen at the state level. And it's a yin and a yang. And while we in Connecticut, we have the opportunity, is we all of our challenges really mirror the problems that you laid out at the beginning. High unemployment, loss of insurance, high costs, even in the best of times, affordability challenges for everyone. State budget crisis due to federal government not sending resources, all of those kinds of things that every state is dealing with. And so in Connecticut, we really believe we've got to leverage the negotiating power of the state. We have to figure out ways to extend coverage that's affordable and quality to everybody in the state. And we need to use the resources at our disposal. And one of our greatest resources in Connecticut is, in fact, the State Employee Health Plan, which covers about 250,000 people. It covers retirees and active employees. And by having such a large base of members, the state of Connecticut as an employer is in a position to negotiate on prices. And so one of the solutions in Connecticut is to actually build some coverage options for people who work for small employers, for people who work for nonprofits, for union members that are self-insured and also struggling with the costs of healthcare. And that creates some public programs in addition to Medicaid that actually can cover people with quality coverage. There's also still the people that are buying on the individual market, as you noted, can't really afford the insurance available through the marketplace, Access Health CT in our state, and may not qualify for the subsidies that are available, and so get stuck. And that number of people is growing more and more. A project we're working on in Connecticut says that there's probably about 50,000 such people right now, and that's before COVID, right? So it's probably increased. We need to be able to figure out ways to use our tax system to generate revenue that can help us provide more assistance to those people as well. So these are the sorts of things that we're talking about in Connecticut. And, I think at the end of the day, whether it's the federal election or the state election, it is our policymakers who have to step up to the plate and make hard decisions. None of these decisions are popular. They run up against opposition from, the insurance industry, the hospitals, the pharmaceutical companies. None of those interests want to see these kinds of actions taken. And so it means courageous leadership. But that leadership won't get exercised unless we exercise our right to vote. And so I want to open it up for questions right now and ask, see if there's any questions. Do we have any hands raised? If not, maybe we have a question in the chat room, and please feel free to pose questions to Stan and to Angie and to me.
Absolutely, Frances. We do have a question in the chat.
Okay.
And this one's for Stan. Could you say something about how Congress or the states can address the high cost of prescription drugs?
Yeah, definitely. As I'm sure most people on the call know, there has been an effort in Congress to restrain the outrageously high prices that are charged by drug companies. And There's the House leadership put forward a bill, House Bill 3, that I think has passed the House, and it has gone to, Senator Mitch McConnell proudly calls himself the Grim Reaper, the killer of initiatives that come over from the House. That's one, but there are members of Congress like Lloyd Doggett from Texas who proposed even more aggressive actions. And really, it's just so important for Congress to step forward and say that there's absolutely no reason why we in the United States should be paying many, many times more for the same medications that people in every other country can get at a fraction of the cost. So that's the federal level. At the state level, there are states that have been moving forward robustly. There are limits on what the state can do. You can't regulate prices, but you can set an upper limit on what you're willing to pay. Maryland has gone down that road. Other states are looking at it. You can say, in Connecticut, we're just not going to pay more than X dollars for a particular drug. And if we can't get it domestically from a drug manufacturer and we need to drive up to Canada and buy some of those drugs and bring them down for an affordable price, well, so be it. And so there are measures that states can take to try to bring down these prices, but it is a tough slog. And as Frances mentioned, there's a lot of money on the table on the other side on this issue, where the drug industry has incredible dollars and power and front groups, and this is not a partisan issue. Democrats and Republicans alike are often beholden to the prescription drug industry. So it is going to take exactly what Frances is calling for: healthcare voters who are focused and who hold leaders in both parties to account and say, you got to do something. It's not acceptable for us to be paying so much more for these same drugs than people in any other advanced country on earth. So I'm grateful to that question.
So, the survey that I referenced at the beginning is the second time we have this survey in Connecticut. The first time was in 2018. And in both surveys, the respondents across party and non-affiliated, okay, so the Democrats, Republicans, and non-affiliated voters all really feel that government has to take certain actions and actually see prescription drug action at the state level as one of those priorities.
Yeah,
so
absolutely.
The people are waiting. They're ahead of their leaders in
Right.
many ways. They're ahead of their leaders.
Right.
So,
well, they're not as beholden financially. I mean,
exactly.
They
got to pay the bill.
Right, exactly. And, one nice thing about Connecticut is you've got some campaign finance reforms in place that tragically we do not have nationally. So, I think there's every reason for engagement and hope at the state level.
Right. And, Rosa, is there any other question for Stan or for Angie?
Yes, we have a question for Angie. And the question is, how has COVID-19 made healthcare an even worse problem for immigrant communities?
Thank you, Rose. Thank you for that question. Throughout the pandemic, we have seen that the undocumented community has felt more scared to go to the doctor and be able to get treatment for COVID, or if they do not know if they have COVID or not, to get treatment on that. Through the middle of the pandemic, the state released an emergency Medicaid program, which allows undocumented immigrants to access to healthcare care only for COVID-19. But if we really think about how the undocumented community has been holding on pain or has been holding on different treatments that they can afford, on top of that, knowing that maybe someone in your family or maybe yourself, you have COVID-19 and not being able to get a full treatment for diabetes or for something for heart disease or for something else that you were waiting to save up some money to be able to be treated, it has impacted them in a way that our community, our undocumented community or immigrant community will not be able to quite restore, right, like in the next 5 or 6 years. Because if they are using all their savings at this moment to treat themselves for any medical programs that they might have, that means that they are left without nothing. We have heard some stories from our immigrant community that even that even at this moment, they are calling back their home countries and seeing how their home countries can help them with any financial stability, because all their savings are done at this moment. So the pandemic has,
And if they've lost their jobs, they also have to use those savings for living expenses like rent and car taxes and car insurance and all of those kinds of things that are still necessary in addition to healthcare costs.
Right, that's correct.
Another question.
Absolutely. This one's for Francis. What can state legislators and the governor do to address affordability to consumers?
Well, I mentioned earlier using the negotiating power of the state. And we know that the problem of healthcare affordability is price. And we know that there needs to be some level setting on prices in Connecticut. We have among the highest healthcare costs in the state. So with respect to leveraging the negotiating power on prescription drugs, as well as on health coverage. If we were able to create some public programs that people could buy into that would allow the state to negotiate on their behalf for more affordable care, then we could make healthcare more affordable. This is not about free care or for anybody. Undocumented people would necessarily have to also pay into the system the way we all pay into the system if they can afford it, right? That's the system we have. We have a system that if you're below a certain income level and you can't afford it, you don't pay. But if you can, you pay something. The question is, what are we paying? What are we getting for it? And those are the harder questions that our state legislators need to address. And I think that by providing the ability to have insurance that is more affordable through the state, that will go a long way. Next question.
Absolutely. This is another one for Stan. Someone wants to know, can you discuss the benefits of expanding state coverage and ACA support versus a national single payer plan?
Yeah, thank you. So I just want to make clear that that my participation here is as an individual. I work for Families USA, but I'm here on my own individual time, expressing my individual points of view. So I will tell you that, in my opinion, the single payer legislation that we've seen from Senator Sanders in the Senate, Representative Jayapal in the House, and their co-sponsors would be a tremendous way for us to move forward. It would take America from being at the back of the list in terms of coverage among developed countries and put it in the front of the list. It would mean just incredible progress on so many levels. We talked about health equity and disparities. Think about what we could do if we could manage the country's healthcare system and say, what are we doing? They set objectives. What are we doing about diabetes among Latino populations, about African American populations? It's going up here. Let's do an intervention. There's so much we could do if we would move in that direction. The problem is, candidly, that corporate political power is enormous in the United States. I mean, even when it comes to just offering the kind of public option that Francis has been talking about, we've seen hospitals and insurance companies and specialty physicians investing huge sums. Colorado, the governor tried to move forward with the public option, got slammed in the legislature with industry. So what do we do? Well, there's a couple things that we need to do, it seems to me. One is we need to continue holding up the single payer legislation as the standard, as the place we need to go. Number two, we need to do what we can to use this present moment to educate the public so that people really come to see with greater clarity the weaknesses of our fragmented employer-driven healthcare system. Number three, we need to act on single payer values in the near term, recognize even if we can't actually pass the legislation we want in the longer term, we have to have a sense of time frame and scope, that this battle is not going to be won in the next 30 minutes. It's not a TV series. Even if you binge watch, we're not going to. It's not even going to be in a year. So my own view is that right now people are hurting so much that we need to come together and do whatever we can to help folks. And there's going to be a longer conversation about the structure of American healthcare that we absolutely need to have. That's going to be a bigger battle, but there's too much pain right now for us to leave that unaddressed pending that larger battle. So my own personal view is we need to do everything we can now, plant seeds for the future, act on single payer values in the short term by making sure that disadvantaged and marginalized populations, people that have historically suffered, are the ones who are prioritized for help as we build towards a longer term and better future.
So, I asked you when you started earlier to talk about Medicare for all, I asked you, I said, hold on that, right? Because, recently someone said to me, we're thinking, we have lost our ability as Americans to imagine what, greater things are possible. There was a time when, a man on the moon was envisioned. When somebody else said, we're going to eradicate poverty, we have stopped being visionary. And we are in a moment right now, a moment that is really what we're thinking, what we've been talking about is piecing and patching together solutions to get to these problems that have been with us long before the pandemic, and solutions because we think we're only able to do this little bit. And even that is going to be a heavy lift. How often do any of us say that, right? The goal really, what I think the pandemic has pointed out to us, that this is the moment in time. This is the moment in time to think about national health care. Whether it's Medicare for all or however it gets structured is less, that's more the how than that we need to make sure we have a system of care. To Angie's point, without your health, you can't do anything. You can't work. You can't raise your family. Without your health, you can't advance. It's a prerequisite for a good life. And so I really think what we need to do, the voting we have to become activated, and we have to become energized, and we have to demand. As Americans, we have to demand, we're all Americans and we're all in this together. We have to demand that our government do better by us, and that one way to do better by us is to give us universal health care. So now that you know our place in our position, I'd love to hear another question or two. We're running on about maybe another couple of questions, and then we'll start to wrap up.
Absolutely. This one's for Angie. Do you think people in Connecticut support your effort to get health care to immigrant families? Do you see evidence that people care?
Yeah, thank you for your question. So I want to mention that the Husky for Immigrants campaign, it is a campaign that C4D is leading and pushing it forward, but we are part of a larger coalition with different foundations, with different organizations that are pushing this campaign forward, like Make That Road Connecticut, like Planned Parenthood, right, like the Universal Healthcare Foundation of Connecticut, and many other foundations and organizations who are interested, who knows that this is important, right? And that's why we want to push this issue to make sure that the undocumented communities have access to healthcare. I do see evidence that people care, right? Our community members and allies have been calling us and sending us the stories, pledging with us to make sure that this upcoming election, they are voting for the issues that matters for the undocumented immigrant community. So we know that having the undocumented community being a healthy community, does not mean it's only for that community, right? If we have a healthy community, that means that all communities are gonna continuously be healthy. Yeah, so that will be my answer for that question. Thank you.
Thank you. And allies are really important in this work. The voice of the undocumented has to be amplified.
We have some.
One last question.
We have someone who wants to ask a question vocally, so I'm going to allow him to talk now.
Okay, can you identify yourself? Representative Michelle.
Hello, can you hear me?
Yes, we
Yes,
can.
absolutely.
Well, I was kind of, I'm listening to all this. It's very interesting. I'm not fully sure on what your position as an entity is on single payer, but I know some of us legislators are working on a single payer for Connecticut, and we haven't drafted any part yet that would establish a role of such bill in the undocumented. So it's crucial that we do so, and we might need some help. So I was wondering if Angie or Stan or yourself, Francis, would be interested in helping us maybe in that part of the works, because this is this is going to be I think a crucial bill to introduce. I'm not sure if it has a chance of passing, but the more we push it as a bill, the more the conversation and the outreach expands across Connecticut, and we just need to do that if we want to get somewhere. Maybe it's this times are going to allow us to maybe actually have some victories, maybe a full victory, but hard to tell right now.
Well, I will say we'd love to sit down and talk with you, and I won't speak for Stan and Angie, but certainly, of course, we would love to sit down and talk with you.
Right, and in my day job at Families USA, we love working with progressive lawmakers like yourself, or any lawmaker who wants to move the ball forward to make sure that we move towards a country where everybody gets the healthcare they need at a cost they can afford. So absolutely, we'd love to work with you.
Yeah, same here. Absolutely. I would love to sit down with, also invite a few other team members from C4D and make it happen and see how we can push this forward.
Absolutely. So I'm going to start winding down, and I want to, first of all, thank you all for your great questions. There's never enough time for these kinds of conversations, but I said at the beginning that we're really kicking off our I Vote for Healthcare campaign, and this is these next few weeks are just going to be critical. At the after this webinar, you will receive a link that will ask you to sign up to be a healthcare voter, and then you will receive from us a healthcare voter toolkit, and that toolkit will have questions that you can use to have conversations with candidates here in Connecticut, and ways in which you can get smarter and help others in your circles get smarter about the healthcare issues and the kinds of actions that we really need to have taken. On October 6th, we are having another conversation. This one's going to be in the form of a training, actually, on a role play to help people get comfortable with the conversation. And I hope you'll come back and bring a lot of your friends and colleagues to that one, because you'll walk away with some skills. And we will also be able to provide some recommendations for how to plan to vote. This is something that is of great concern. A lot of people are unsure about the absentee vote, or unsure about, or feeling insecure about going to vote in person. We want to make sure that everyone who can vote will vote this year. And we're doing our part. Other people are doing their part too. We're not, the only ones working in this space. But in terms of healthcare, we really believe it's so critical. And so on October 6th at noon, we will have another session, and you will be receiving an invitation to that as well. I thank you, Stan, for making the time today and being here with us. I thank you, Angie, for being here with us as well, and both of you for your leadership and your courageous thinking about the things that need to happen in this country and in this state. And I thank everyone who has joined us today. Some of you have come back from prior ones, and some of you are coming to us for the first time, please stay tuned. We will continue to have these conversations, and I am pleased, very pleased to have spent the past hour with you. Take good care.
Thanks so much,
Stay
Francis.
healthy.
Thank you so
And
much.
hooray to the
Francis.
Universal Healthcare Foundation of Connecticut. Yay!
Our 20th anniversary is this year. 20 years we've
Oh my
been at
God,
this.
congratulations.
So, you know, I want to be able to say, now we can go out of business because we've gotten universal health care. Come on, help us out. All right, folks. Take
Thanks
good care.
very much.
Bye.
Bye-bye.
Take care. Bye-bye.